I'm Dr. Cynthia Ruth Butlin. I'm a retired medical missionary, used to work for the leprosy mission in South Asia, and nowadays I continue to do voluntary work for the mission both abroad and in the UK. My concern for leprosy affected people dates from when I was a teenager, and I heard a promotional talk by one of the staff of the leprosy mission at our local church youth club. At that time he was pointing out that there are about 15 million leprosy affected people in the world, of whom only about 1/5 are receiving any kind of treatment. And I thought that was heartbreaking, given that there was already a known cure for the leprosy infection. And so I determined that if I could get into medical school and qualify, I would apply to the leprosy mission to work. So first of all, I was sent out to Richardson Leprosy Hospital in Miraj in Western India. I was basically in charge of the hospital patients, outpatient clinic and the ward work, but I was also teaching field workers who would be engaged in the National Leprosy Control Programme throughout India. I also later on began to assist with some research in that centre. In 1991 I was moved to Anandaban in Nepal to be the medical superintendent of that large referral hospital, and then in 2001 moved back to India for a couple of years and finally worked in Bangladesh for the last 4 years of my overseas career. Well, as many people know, leprosy is an infectious disease. It's caused by a mycobacterium, which is similar to the bacteria that causes tuberculosis. The leprosy infection itself can easily be treated by a combination of antibiotic-type drugs. Nowadays, there are about 200,000 new cases per year, the majority of whom will receive the multi-drug therapy and often through government channels. However, a large proportion of the patients will be left disabled even after receiving their multi-drug therapy. And so there are probably at least 3 million people in the world with leprosy-related disabilities who need ongoing care. Being shortlisted for this award means that I get an extra opportunity to publicise the needs of leprosy-affected people and the wonderful work that the Leprosy Mission is doing in different countries. And so I'm very happy to have this possibility of speaking to a wider audience about the leprosy unmet needs in leprosy field.